Hi everyone, good day. I am James Oswald Pirolias, your student nurse, and today I'll be going to show to you on how to properly assess the skin of a patient. But before that, let me show it to you what are the equipments that will be used for this assessment. So without further ado, let's get started. That I'll be doing and I'll be checking some part of your skin, and there's a procedure improvement that you must follow if it's okay with you.
Yes, I'm okay.
Okay. If you feel uncomfortable, just tell me. Feel free to raise your concerns, and the information will be kept confidential and will be safely handled to the doctor. Am I clear, or do I need to repeat it to you?
Yes, loud and clear.
Okay, that's all right. So now let's proceed for the current complaints of the client. Um, do you currently experiencing skin problems such as pigmentation, swelling, or dryness of the skin?
No, no.
Mm, mm. So are you experiencing some skin problems now?
No,
Any allergic reaction to food or medications?
no, no.
Are you using some skincare products or lotions?
Nothing.
So, so does anyone in your family have have their skincare problems?
No, no.
Okay, so now we will proceed to assessing your skin. If it's is it okay to you?
Yes.
Okay. Stop. For inspecting the skin and its color, look for any color variation such as redness and jaundice. And also upon examining, look for any signs of emanating of the skin, moisture of the skin, and, and check for skin folds and exposed areas. Next is for the temperature. I'll be use the dorsal surface of my hand to palpate the skin. Uh, okay, so for the texture, I will use the palmar surface of my hands. To assess the texture, pinch the pinch the skin, watch the speed and how it lines up. Okay. So lastly, for edema, if there are no signs, then don't don't examine. But if there are signs, then you need to follow the ABCDNE method, which is asymmetry, regular border, color, color, diameter, um, um, and elevation. And last thing to do is to summarize the information obtained, discuss the findings to the client. Provide the client opportunity to raise concerns, and of course, don't forget to take the client for his time and cooperation. And he must do the proper hand washing after the assessment and document findings of client records. For my follow-up assessment, it shows that he is all well and good, normal, and the doctor decided that he can be discharged. So you can go home now. If you have any questions or clarifications, don't hesitate to ask me. Is there any?
No,
None.
none.
And so far, all right. thank you for your time and cooperation. I am happy that you are all well and good. So don't forget to so don't forget to do the proper hygiene and stay hydrated. That's all. Thank you.
Thank you, nurse.
Now we're done for skin assessment. Let's proceed to the other one, which is eyes assessment. Um, Good day, sir. How are you today?
I'm fine.
Um, well, I am Jerix Ashulpiro Llanas, student nurse from University of Mindanao, and I'm going to assess your eyes. What is your name, please?
My name is Prince.
Your complete name, sir.
My, my name is Prince Jamal Pedrosa.
Alright, how would you like to call you?
Prince,
Okay, when is your birthday?
August 2,
What year? Yes.
2003.
Alright, so the procedure that I'll be doing is to check some parts of your eyes, and there's a procedure improvement that you must follow if it is okay to you.
Okay, sir.
Alright, so if you feel uncomfortable, just tell me, and feel free to ask if there's a concern or questions that you might to ask to me then. And the information that the information that provided will be kept confidential and will be safely handed to the doctors. Am I clear, or do I need to repeat to you?
Yes, sir.
Repeat.
No.
Alright. So, uh, next is I have to check for visual aids prior to starting the test. Are you using contact lenses or graded glasses?
No.
Alright, let's proceed to the next one. Is I have a Snellen chart. Then you have to read it with your left eye, right, and both eye uncovered. Let's get started then. Hey, but first I have to use it should be cardboard, but I have no cardboard, so I need to use your wallet for improvise. So let's start with your wait. So let's start with your right eye. Then you have to read it. That's my chance.
Okay.
Read it.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D B E F P O T E C L E F O D P C D F D P L P C E D.
Alright, so next is the left. Pwede paliko lang. Then, ibang itabon sa mong left eye. Cover.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D F P O T E C.
Are you done?
Yes, sir.
So read it with both eyes uncovered.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C L E F O D P C D F D P L T C O P E Z O L C F T D.
Alright, so let's proceed to the other one then. So you have to tell me kung ilan ang fingers na aking ipapakita or lalabas. So let's get started. So
1, 2, 3, 4, 5, 4, 3, 2, 1.
Alright, good. Then you need to kailangan mong sabihin sa akin kung saan papunta or direction ng aking finger.
Right, up, down, left.
Okay, good. Mm. Then you have to um, look you have to look at the you have to look at me directly in the two eyes.
Okay, okay.
Alright, so okay. So I have to use like a light. Wait. The next is you have to tell me if my magcontact pag so that
Okay.
wait lang. Pag nasa center is you have to say you have to tell say okay.
Okay. Okay.
Ito.
Okay. Okay.
Good. Next is I have to inspect your eyebrows by using candle light. Open your eyes. Okay. Your eyes are aligned. Okay. Eyes are aligned and symmetrical. Eyebrows are distributed. Slightly arch, eyelash are both distributed. Purely and slight, then slight upwards. So I have to inspect your iris and pupil to open your eyes up. Let's check for eyes. Use pen to check cornea and lens for opacities. Okay, there are. So next is I have to dark the room partially. Wait lang. Consensual, this means that your both eyes are constructed right, which is pretty normal. Next is to do Herzberg test by using pen light in eyes and look for reflection of it in the corneas. Just look straight. Alright. Next is I have to do or perform a gaze test, which means that you have to follow the tip of my pen light. Don't move. Don't move your neck, just eyes up and down. Your eyes up and down. Wait. Alright, so the result was your right eye vision is 20/25 and the left eye is 20/30, and your both eyes is 20/20. Uh, for visual for visual fields, the which I did when I was wiggling my fingers, and you say okay earlier. So your your upward field is at 50 degrees, downward field at 70 degrees, and your nasal field at 50 degrees, which is normal. For the inspection of your eyes are aligned in symmetrical, eyebrows are evenly distributed, and orange eyelashes are curled upward of the eyelids. And skin is intact, flow symmetrically, no discharges, no discolorations, and have normal blinking, which is 15 to 20 blinks per minute. Sclera is white, which is normal, and your vulvar conjunctiva is good. Iris and pupil are both normal, no opacities, and the pupil is at 3 millimeters, which means is normal. Pupils reacted to accommodation, which is normal too. Cardinal fields are cardinal fields case that both eyes are coordinated. So everything is pretty normal. So my recommendations or suggestions for you is don't expose too much to gadgets. Then you have to consume vitamin A rich, and rest after long and rest after using your gadgets. So that's it. Thank you, sir. That's all.